Clobetasol, how to use, side effects, and safety warnings. Clobetasol propionate is a potent corticosteroid used to treat various skin conditions, including psoriasis, eczema, lichen planus, and lupus. It helps reduce symptoms such as pain, itching, redness, dryness, crusting, scaling, inflammation, and discomfort. This medication is available in multiple forms: cream, ointment, gel, spray, foam, lotion, and shampoo. What is clobetasol? Clobetasol propionate is a synthetic corticosteroid that belongs to the class of super high-potency topical steroids, significantly stronger than common alternatives like hydrocortisone. This medication works by activating natural substances in the skin to reduce swelling, redness, and itching associated with inflammatory skin conditions. The active ingredient, clobetasol propionate, is a white to almost white crystalline powder that is practically insoluble in water. This medication is available under various brand names including Temovate, Cormax, Clobex, Olux, and Dermovate, providing patients with multiple options for their treatment needs. What are the benefits and uses of clobetasol propionate? Clobetasol propionate offers significant therapeutic benefits for patients suffering from moderate to severe inflammatory skin conditions. The medication demonstrates exceptional effectiveness in managing symptoms and improving quality of life for those with chronic dermatological disorders. Conditions clobetasol propionate treats. Clobetasol propionate is primarily prescribed for treating various corticosteroid-responsive dermatoses. The primary conditions include psoriasis, particularly effective for plaque psoriasis, helping reduce the characteristic red, scaly patches. Eczema, provides relief from moderate to severe eczema symptoms including itching and inflammation. Lichen planus, helps manage this inflammatory condition affecting skin and mucous membranes. Dermatitis, effective for various forms of dermatitis including contact and atopic dermatitis. Lupus, assists in managing skin manifestations of lupus erythematosus. Secondary uses of clobetasol propionate. Beyond primary indications, clobetasol propionate cream uses extend to treating lichen sclerosis and other inflammatory skin conditions that respond to high-potency corticosteroids. The medication may also be prescribed for scalp conditions when formulated as clobetasol scalp solution, providing targeted treatment for scalp psoriasis and seborrheic dermatitis. How does clobetasol propionate work? Clobetasol propionate functions through a complex mechanism involving cellular signaling, immune function regulation, and protein synthesis modulation, though the precise mechanism in corticosteroid-responsive dermatoses remains not fully understood. The medication works by binding to glucocorticoid receptors in skin cells, leading to anti-inflammatory, antipruritic, anti-itch, and vasoconstrictive effects. This process involves inhibiting the accumulation of inflammatory cells at inflammation sites, reducing phagocytosis, and decreasing lysosomal enzyme release. The medication also helps calm the immune system's defense cells, white blood cells, and prevents them from releasing inflammatory substances. Additionally, it causes vasoconstriction, narrowing of blood vessels, where applied, which helps reduce swelling and redness. How to use clobetasol. Forms: cream, gel, ointment, lotion, foam, spray, use twice daily, and shampoo, use once daily. Application: apply to the affected area and gently rub in. For foam, spray, or solution forms, apply to the scalp and avoid washing or rubbing until dry. Shampoo, massage into the scalp, leave for 15 minutes, then rinse. Do not cover the head. Flammability: clobetasol foam is flammable, avoid open flames. Avoid contact, keep away from eyes, mouth, and do not swallow. Clobetasol propionate dosage. Proper dosage administration is crucial for maximizing therapeutic benefits while minimizing potential side effects. The standard concentration for all formulations is 0.05%, representing a super high potency corticosteroid strength. Typical dosage instructions, as per doctor's advice. For cream, gel, ointment, lotion, foam, and spray. Apply to affected areas twice daily, morning and evening. Use a thin layer and rub gently into the skin. Maximum weekly usage should not exceed 50 grams. Treatment duration should not exceed 2 weeks for general conditions. For plaque psoriasis, treatment may extend up to 4 weeks maximum. For clobetasol scalp solution and shampoo, apply once daily to affected scalp areas. For shampoo, massage into scalp, leave for 15 minutes, then rinse thoroughly. Avoid washing or rubbing the scalp until the solution is dry. Special considerations: avoid application to face, groin, or underarms unless specifically directed by physician. Do not use occlusive dressings unless instructed by healthcare provider. Clobetasol foam is flammable. Avoid open flames during and after application. What should I do if I miss a dose? If you miss a scheduled application, apply the medication as soon as you remember. However, if it's almost time for your next scheduled dose, skip the missed dose and continue with your regular dosing schedule. Never apply a double dose to compensate for a missed application, as this can increase the risk of side effects and systemic absorption. What happens if an overdose occurs? Overdose situations require immediate medical attention, particularly if the medication is accidentally ingested. Symptoms of overdose: systemic corticosteroid effects including adrenal suppression, high blood sugar levels and associated symptoms, Cushing syndrome manifestations, severe skin reactions or worsening of treated condition. What to avoid? Never exceed the prescribed amount or frequency. Avoid using on large body surface areas simultaneously. Do not continue treatment beyond recommended duration. Avoid covering treated areas with occlusive dressings unless directed. What are the side effects of clobetasol propionate? Understanding potential side effects helps patients recognize when to seek medical attention and ensures safe medication use. Most side effects are localized to the application site, but systemic effects can occur with prolonged or extensive use. Common side effects. The most frequently reported side effects occur at the application site and typically resolve as the skin adjusts to treatment. Burning, irritation, itching at the application site. Serious side effects: adrenal insufficiency, low blood pressure, fainting, dizziness, tiredness, Cushing syndrome, high blood sugar, intense thirst and hunger, frequent urination, high blood pressure. Precautions and warnings. Careful consideration of patient history and current health status is essential before initiating clobetasol propionate therapy. Healthcare providers must evaluate potential risks and benefits for each individual patient. Who should avoid this medicine? Certain individuals should not use clobetasol propionate or require special monitoring. Allergy history: patients allergic to clobetasol, other corticosteroids, hydrocortisone, dexamethasone, or any inactive ingredients. Active skin infections: those with bacterial, viral, or fungal skin infections at treatment sites. Certain skin conditions: patients with rosacea, acne, or perioral dermatitis. Compromised skin barrier: individuals with severely damaged or broken skin. Conditions where caution is needed. Several medical conditions require careful monitoring during clobetasol propionate treatment. Diabetes: the medication can increase blood sugar levels, requiring closer glucose monitoring. Poor blood circulation may affect healing and increase absorption risks. Immune system disorders can potentially worsen immunocompromised states. Cushing syndrome history: previous episodes may increase recurrence risk. Liver or kidney disease may affect medication metabolism and clearance. Are there any age restrictions for using clobetasol propionate? Clobetasol propionate use in pediatric populations requires special consideration. The medication is generally not recommended for children under 12 years of age due to increased risk of systemic absorption and growth suppression. For adolescents 12 to 17 years, only the emollient cream formulation is typically approved, and treatment should be closely monitored for growth effects. Alcohol or food interactions. While direct food interactions are minimal, Alcohol consumption may exacerbate certain side effects, particularly blood sugar elevation in diabetic patients. Patients should maintain consistent dietary habits and monitor blood glucose levels if diabetic. The medication should not be applied to areas that may come into contact with food preparation or consumption. Possible interactions with other medications, drug interactions. Clobetasol propionate has relatively few direct drug interactions due to its topical application, but certain combinations require monitoring and potential dosage adjustments. Overview of drug interactions. The primary concern involves concurrent use with other corticosteroids, which can increase the risk of systemic corticosteroid effects. Patients using oral, injectable, or inhaled corticosteroids, such as prednisone, dexamethasone, or methylprednisolone, may experience enhanced effects when combined with topical clobetasol propionate. Medications requiring caution. Oral corticosteroids, prednisone, prednisolone, methylprednisolone. Inhaled corticosteroids, used for asthma or COPD treatment. Injectable corticosteroids, joint injections or systemic treatments. Other topical corticosteroids, concurrent use on different body areas. Possible impact when combined with supplements and herbal products. While specific interactions with supplements are limited, patients should inform healthcare providers about all supplements and herbal products being used. Some considerations include blood sugar affecting supplements, chromium, cinnamon, or other glucose modulating supplements may interact with clobetasol's blood sugar effects. Immune modulating herbs, echinacea, astragalus, or other immune stimulating herbs may counteract anti-inflammatory effects. Topical preparations, avoid using other topical medications or cosmetic products on treated areas unless approved by healthcare provider. Patients should maintain a comprehensive medication list including all prescription drugs, over-the-counter medications, vitamins, and herbal supplements to ensure safe treatment. How should clobetasol propionate be stored? Proper storage ensures medication stability and effectiveness while preventing degradation that could reduce therapeutic benefits. Following storage guidelines also ensures safety for household members, particularly children. Recommended storage temperature for clobetasol propionate. Clobetasol propionate should be stored at controlled room temperature between 20 degrees Celsius to 25 degrees Celsius, 68 degrees Fahrenheit to 77 degrees Fahrenheit. Brief temperature excursions are permitted between 15 degrees Celsius and 30 degrees Celsius, 59 degrees Fahrenheit to 86 degrees Fahrenheit, but prolonged exposure to extreme temperatures should be avoided. Specific storage requirements. Do not refrigerate. Cold temperatures can alter the medication's consistency and effectiveness. Do not freeze. Freezing can damage the formulation and render it ineffective.